Hi, so my name is Karen. I'm going to be your nurse today. And before we get started on assessing your abdomen, which is your stomach area, I just wanted to ask you a few quick questions. Is that all right?
Okay.
Okay. And what's your name?
Diana,
And how old are you?
28.
Okay. Lately, have you been having any trouble swallowing?
No.
Okay. Any problems after you eat with like burning or regurgitating your food?
No.
Okay. Any abdominal pain recently? Stomach cramps, bloating, anything like that?
No.
Okay. How about any changes in your bowel habits?
No.
Okay. How about changes in appetite or notice any rapid weight changes?
No.
Okay. Do you drink alcohol?
Occasionally.
And how much, on average, would you say you drink per week? How many beverages?
Maybe one or two.
Okay. And are you taking any medications currently?
Not right now.
Okay. So why don't we get started? First, we're going to have you lay down. Okay. And I'm just going to lift up your top shirt here. I wanted to see your abdomen and make sure that there's no bulges or lesions. And I'm just going to have you lift your shirt up real quick.
Okay.
Just to make sure. Okay. Looks like it's healthy and no cuts or lesions, no hernias, no previous scars from any surgeries in the past?
No.
Okay. So what we'll do first is we're going to listen to your stomach and make sure that there's peristalsis, which is kind of the movement of your bowels, and listen to the aortic arteries, which we listen for bruits. Sometimes that is an indication of something that is abnormal. Whoops. All right, so we're going to listen to the four quadrants, the upper right, the upper left, and lower right quadrants. And you want to listen to each side for approximately 3 to 5 minutes. You want to listen to peristalsis about 5 to 30 like rumbling, gurgling sounds in each side. Good. Okay, great. So all four quadrants are exhibiting normal bowel tones, which is about 5 to 30, like I said, tones per minute. So after listening to the quadrants, we want to also listen to any of the arteries for bruits, which is the aortic artery. It's like right above the umbilicus here. That's where the branch is for the aortic artery. And you want to listen to that both using the bell side and the diaphragm of the stethoscope. And then branching from there are also the iliac and renal arteries. Okay, good. Also, when auscultating the stomach, you want to make sure you can listen for friction rubs in the liver, which is on the right upper side of your stomach, and then the spleen is on the upper left-hand side. And when you hear friction rubs, that's a normal finding. We'll just listen to that real quick. Alright, so normal sounds when you're auscultating the stomach are, the gurgling. And next, after listening to the sounds, you want to percuss each quadrant. So percussion is basically taking one finger and listening for changes in sound as you go along each quadrant. And this is also used as a way to measure the size of the liver. You listen for a dullness, and that's the beginning of where the liver border is, the hepatic border. And you do the same thing on the left-hand side with the spleen. But it's a little bit harder because the spleen is behind the rib cage. But we'll go ahead and percuss. And a normal finding is tympany, which is basically no dullness in the stomach because there shouldn't be any, it's filled with air basically, so there shouldn't be any dullness except for when you go over an organ like the liver or the spleen. So how you do that is basically you take your middle finger and you go from the midclavicular line along the umbilicus here, and then start percussion there. This is how to find the liver borders, and then we'll do all 4 quadrants afterwards. You basically go along, and then once you hear a different dull sound, that's usually where the liver border begins, and you want to mark that. And you do the same thing, except for you start a little bit higher this time, midclavicular line, and then you find the top border of the liver. And you want to go in between the ribs because otherwise you'll hear a dull sound if you tap the ribs. And so that's how you measure for the liver borders, and usually that's about 4 to 7 centimeters in length there. And then you do the same thing on this side. And basically percussion, you just want to hear all 4 quadrants producing the same tympanic sounds, and no dullness or enlargement of any of the organs. Alright, and so next you want to also assess with palpation. So basically that's feeling the abdomen, making sure there's no tenderness or any pain that's produced when I lightly touch your stomach, okay? So just let me know if you experience any pain. This is just light palpation in all 4 quadrants. Okay, any pain?
No.
Okay. Alright, so after that you want to do deep palpation also, which is a little bit deeper, pressing in, and then this is also when you want to feel for the liver and the spleen. And you do this by pressing a little bit deeper in each quadrant. Upper left is where you can feel the spleen, which is a little bit harder to find. So can you take a deep breath? And sometimes that'll you shouldn't be able to feel it because otherwise that can indicate an enlargement. On the liver, you want to press down. Can you take a deep breath? Okay. And sometimes people use the hooking method, which is it's a little bit easier to do from the other side, but basically you go under the rib cage, press deeply, and can you take a deep breath? And sometimes the liver will move down where you can feel it. Yeah. Alright, and after that, you want to also check the inguinal region for any bulges, which is like right in this area here, and any tenderness in that area. Next is just going through all the abdominal organs, which we've mentioned the liver is on the right upper side, spleen on the left upper quadrant, and then you have both kidneys on the flank side. So you can also try to palpate the kidneys, but it's a little bit harder to do that. It's on each side here, and you want to do it using deep palpation. And then you feel for it on this side and press them down and up from the patient's backside. Any tenderness there? Okay. Alright, so there's a spleen, and as I mentioned, the aorta goes down the center of the abdomen right above the umbilicus. Next is the abdominal reflexes, which is usually a sort of tool, and you kind of start from the umbilicus and you kind of radiate toward each direction here, and then you watch for any contraction in the abdomen, and that's a normal finding. That's a normal reflex. So that's how you test for abdominal reflex. And the next test is the rebound tenderness test, which is basically what they do to check for possible appendicitis. So basically you want to press down on McBurney's point is what they call it, which is the lower right hand side. And how you find that usually is you can find your hip muscle or your hip joint here and your belly button, and then kind of go about 2/3 of the way down, and then that's McBurney's point. So you want to press down on that side, and usually you got to ask the patient if it hurts more when pressing down and applying pressure or when released. Pressure? Okay. No pain on release. Okay. And that's how you test for rebound tenderness. The next test is called the iliopsoas muscle test, which is basically me pressing, holding my hand above the patient's thigh, and can you please lift your leg up and press up against my hands? Does that produce any pain?
No.
Okay, good. And that's a normal finding. If the patient experiences pain during that test, usually it could indicate appendicitis or peritonitis, which is inflammation of the peritoneal space. So you could also do it by bending at the knee and then pressing up against my hand. Any pain there?
No.
Okay. And the next test is the obturator muscle test, which is basically also bending at the knee here, and then you turn outwards. Any pain?
No.
And then you also want to try turning inwards. Any pain there?
No.
Okay, great. And that also tested for the same thing, appendicitis or peritonitis. Ballottement is a test used to check for any excess fluid in the stomach, which is kind of with ascites. Sometimes people will get excess fluid in their stomach. So basically, what they do is palpation of the stomach, and sometimes when there's excess fluid in there, you tap it, and then the organ will kind of bounce up and into that liquid, and that's what they call the ballottement. And then the scratch test for the liver is basically using your stethoscope, and it's another way to locate the liver basically. So you put your stethoscope on and you auscultate near the liver, right here, and then basically you scratch, and then it should produce a different sound once you get above the liver. And so that's another way that people test to locate the liver. All right, so that concludes our examination. Do you have any other questions or concerns?
No.
All right, thank you.
Thank you.